George Chimento is going to talk to you about that. And
Hi, I'm George Chimento. I'm one of the total joint surgeons and chair of the Department of Orthopedic Surgery. Dr. Brad Waddell is our Director of Orthopedic Research. He couldn't make it today, so I'm going to pinch hit and give this talk for him about what we have going on in research opportunities for orthopedics. Like a little background information, we have a good track record, I believe, with UQ and the UQ students. We've matched two into our program in the last 4 years, and both of them were involved in research from an early time and worked on several key papers with us, got published, got to present their research nationally and I think internationally in a couple of cases. So there's some definite benefits if you're interested in the field of orthopedics to get started early with doing some research. And by early I mean before, like a week before match. That's a little too late. A little sooner than that would be a good thing. We have several studies in the orthopedic department. Dr. Waddell counted, we have over about 100 studies. The majority of our studies are on the total joint side of things. Between the two of us, we have about 50 active studies. There's also studies in foot and ankle trauma, pediatrics, and spine. Our sports department, section of sports medicine, which is located over at Elmwood, takes care of the Saints and the Pelicans, but they also have several studies. They have an enormous database, and I think the issue has been touched on is just finding people to kind of help mine the database and help get some of these projects come to fruition. We have investigator-initiated studies where we decide to look at something. We have some funded industry studies also where one of the total joint or spine implant companies wants us to participate in a specific study. And those are across the board in both spine and total joints. And there's several studies in sports medicine on some of the biologic uses of bone graft and meniscal transplants and collagen transplants in sports. So what we decided to do was use just an example of some of the studies that we have, just to give you an idea of what we're doing. And one of them that we've actually pretty much completed, we looked at review of metal-on-metal total hip arthroplasty, and this was a big thing about 10 years ago until they found out that they failed miserably, and it created a whole bunch of issues. So what we did was we followed these patients out to see how it affected them, and I think we have one of the biggest data sets available on that. And we actually had one or two of the UQ students help us with that. This is one that we're very excited about. This is a multi-center, multidisciplinary study that there's grant money available for. It's a funded study through the Orthopedic Research and Educational Fund. And what it does is it examines the best way to treat a patient with an affected total joint, whether we use a one-stage procedure to remove the joint and implant a new one at that time, or whether we use a two-stage procedure. There's some of the major centers in the country, special surgery, I believe UCLA, Ortho Carolina are involved in this study, and we were fortunate enough to get selected. So this is just another example of something we have. This is just an example of what we do for multidisciplinary studies. This was in conjunction with our transplant colleagues looking at joint replacement outcomes after abdominal organ transplantation. Since we do so many transplants here, we have one of the largest data sets in the country on this specific subject. And this was recently completed, and I think it's been accepted for publication. And this is a new study that's just getting off the ground. Dr. Waddell is spearheading this, and it's a way of looking at digital hemoglobin. It's a sensor you can put on your finger, so instead of having to get labs drawn, you can get your hemoglobin measured through this sensor device. So we're in the process of evaluating this and see if it's accurate and see if it works. So this is an example of an industry-funded study. So we have several other things going on, but the points I wanted to make with those are that we, some of those studies are investigator-initiated, some were industry-initiated, some we approached the company and secured funding, and some were basically based on grants. So we also work very well with other departments and doing some multidisciplinary studies also. And I'm sure you've heard this before, but what we need is help with looking at the data, collecting the data, putting the data together, helping to form and write the manuscript. And the way we approach it is if you have a vital role in the study, if the study gets accepted as a meeting, then you can go present the study if you wish. We've had some students go to several different meetings and present. I mean, we're there, you're not left hung out to dry. It's a good opportunity to get some face time, especially if you're interested in orthopedics, kind of get up on the podium and people know who you are. So basically that's it. Does anyone have any specific questions? Very good. Well, thank you.